Hey, good evening. My name is Captain Dan Pionk, and I'm the Executive Director of the Navy Supply Corps Foundation. Can everybody hear me okay?
Yes.
Great. Well, welcome tonight's webinar. We're very proud to host this webinar tonight on COVID Supply Chain Task Force. Um, but first, I'd like to thank our sponsor, CTG, Division of Blue Raven Solutions, for sponsoring this webinar. CTG sponsors all our webinars in the past year and really thank them for their contribution and support to the Navy Supply Corps Foundation. CTG provides supply chain solutions designed to keep fleets and systems operational, ready, and safe. CTG is a leading supplier of parts, material, and obsolescence management solutions to the Department of Defense and its contractors, as well as many of the world's largest airlines, MROs, and aircraft manufacturers. Again, thank you to CTG, a loyal sponsor and supporter of the Navy Supply Corps Foundation. First, before we get into the webinar, just a little quick background on the foundation for some of our folks who may not be familiar with the foundation. So basically, our leaders and members are anyone who's ever worn the oak leaf of a United States Navy Supply Corps officer, whether they're veterans, active duty, reserve, or prior service. We provide global programs and services to support the Navy Supply Corps community and promotes heritage and tradition. That's really our mission. What can we do for you? Well, we're your connection to the rest of the Supply Corps. We provide professional and social networking. We provide leadership opportunities both at the foundation board level and our 38 chapters worldwide. We've always need volunteers, and if you're interested in either serving with the foundation's board itself or with one of our chapters, just let me know. Volunteers is what makes the foundation run. And now I'd like to turn over to the vice chairman of the foundation, Ted Diggs, Captain Retired Ted Diggs, who's going to introduce our lead panelist for tonight's webinar. So Ted, over to you.
Thanks, Dan. Good evening. It's my honor to introduce tonight's speaker, Admiral John Polofchek. John and I go way back to when we were lieutenants at Navy Supply Corps School in Athens, Georgia. During his very successful Navy career, he gained expertise in finance, logistics operations, ERP, acquisition, and contracting, all of which became immensely important when he was tapped by Vice President Mike Pence to lead the COVID-19 Supply Chain Task Force. What you're about to hear is the execution of a critical mission at an extraordinary moment in our history. In March of 2020, with the onset of the pandemic, the nation was frozen in fear and uncertainty, but something had to be done: find, organize, and distribute protective equipment. Well, what the White House needed was a logistician, and they needed a kind of leadership found in a senior military officer. And finally, they needed someone who came from a culture of can-do, who will figure out a way to succeed, even if it's never been done before. What they discovered they needed was a Navy Supply Corps officer. Admiral Polofchek's story is a testament to his training, his talent, and certainly his team. But as a community, we should all wear his team's success as a badge of honor for the Navy Supply Corps. So without further ado, Admiral Polofchek.
Hey, Ted, thanks very much. Dan, thank you. I don't know, Ted, can you hear me? All good?
Yep, all good.
Yeah, and Dan, if you can bring up the slides, that'd be great. Yeah, right. So, first of all, again, thanks for having me. Second, this isn't going to be about me. There were a lot of individuals across DoD, other cabinet secretaries, civilian agencies, and commercial that made things happen. I was just kind of in the center, directing traffic, so to speak. And there were several Supply Corps officers with me, two from the Joint Staff, a Captain Richie Jenkins and a Colin Amaro. Colin was my EA. He was a lieutenant. Like this was like his, first short tour after his aircraft carrier tour. And I can't speak enough about Richie and Colin. And then Jim Liberco from DLA was my IT savior in this. And so this is much a story about the supply chain task force as the leadership and the work that those three officers did as well. I got the benefit of the services sending me some absolutely wonderful officers. And we may touch on those. So what I'm going to do for the next 15 minutes or so is talk about the task force, talk about the work we did, talk about some thoughts on how that work would be connected to maybe today's Navy. And then I'm going to leave time for Richie and Colin to talk about their personal observations. And so here we go. I think we're going to leave time for questions. And I know that there's been some questions submitted already. But, you know, to start with, how did I end up briefing from the White House podium? Right. So we're gonna walk that timeline for you. So Dan, if you can go next slide. So Friday, the 13th of March, Colin and I were sitting in my office because I had an approved retirement. And I think my last day of work was like 26th of June. And Colin and I had plotted out how much days for house hunting, how much leave I was going to take, when I was going to take it, et cetera, because I had approved retirement of 26th June. And then on that day, the president declared a national emergency. So I went home that weekend, talked to my lovely wife, Karen, about this grand plan of what leave I was going to take, et cetera. And sometime Sunday late afternoon, the director of the Joint Staff, General Van Herk, who ended up being Northcom, called me and said, hey, John, I just got off the phone with the secretary and the chairman. They'd like you to take some people and go over to Health and Human Services on Monday and see what they need. They need HHS, Health and Human Services, needs help planning logistics for the pandemic. And I'm sorry, but we as a nation were knee deep in execution of pandemic. So I said, okay. And I called the chief of staff, Captain Julie Traynor, and I said, hey, Julie, make several phone calls. I'm going to need these types of people. I think these people should go with me and make sure that they're prepared on Monday to go over to Health and Human Services. That was Sunday evening. Monday, we fight all day to get into Health and Human Services. It was an organization that I found that if the cabinet secretary or some other political didn't like tell people to go do something, they didn't go do it. And so at some point, they figured out that no, really, Secretary Azar called Secretary Esper and said, hey, I need like some help here. And so we got in the door late afternoon on that Monday, spent Monday, Tuesday setting up and talking to Health and Human Services. And what I found was an organization that was kind of sitting around waiting for the next thing to do. And I guess the things I was saying were making sense to them because by midday Wednesday, I was asked hey, I think the vice president wants to stand up a supply chain task force. We want you to lead it. I'm like, okay. Thursday, we went over to the White House, met the vice president, who I previously knew because I lived on the Naval Observatory. And long story in all of this, but I had to move out of my house to let the Pences move into my house, one of the vice president mansion being renovated. We lived very closely with them. They used to have to walk past my house to walk their dog, et cetera, et cetera. So I knew the vice president reasonably well. Ended up talking to the vice president, Mr. Kushner, Peter Navarro, and a few others about the things that they were doing, and convinced them that they really couldn't run that out of the White House, that to let me stand up as task force at FEMA and do certain actions. So I started attending the vice president's COVID task force meetings by that Friday. Sunday, Vice President Pence asked me to come back and talk about this task force and what we were going to do and who was going to be on it. And in that session, Pence pulled out one slide, kind of like an org chart and said, "Hey, Admiral P, I need you to brief the nation on that tonight." And it was like 4:30 in the afternoon. They all get up and leave, and they're like, "Okay, let's go up to the Oval." And I'm sitting there kind of go, okay. Um, Walk out of the Situation Room, and I look at Colin, and I go, "Colin, I think I'm supposed to be in the Oval Office. Where's that?" And luckily, Colin had been a social aide at the White House. So not only working on the Joint Staff, putting in all those hours, doing social aid things at the White House. And I cannot tell you how much I benefited from his knowledge of, you know, where things were, who was doing what. And next thing I know, Colin's leading me up the Oval. I walk into an outer room, and there's Attorney General Barr, who greets me and says, "Hey, Admiral, I understand you're standing up a supply chain task force. I have a price gouging hoarding task force that I think we're going to be working very closely together." He hands me his business card and says his special attorney is going to be calling me. And I'm patting myself down. I don't have a business card. I don't have anything. I'm like, "Colin, can we give the Attorney General my email?" Next thing I know, I'm in the Oval briefing President Trump on the task force, and out to go to the White House podium for my first White House podium trip of many. And there we are, off and running. And now the nation knows that we have a supply chain task force, and I'm in charge, and off and running. So if for those that are keeping track, that was Sunday to Sunday, Sunday to Sunday. And I can't tell you the pace and how things moved, and the ambiguity of it all. So Dan, if you can go next slide. Now, I want to take you back to March of 2020 when certifiably, I think we all thought we were going to die. On the right-hand side here, we were tracking daily deaths and daily new cases and all of those things. And you were watching the news, and, people were in the hospital, and, we were closing everything down, right? And you had headlines like this from the 19th of March from the New York Times: "At war with no ammo. Doctors say shortage of protective gear is dire," right? And so that was the backdrop that I got dropped into. Go fix this. So Dan, if you can go next slide. And so just a quick operational setting, right? So I'm standing up this task force, working for Vice President Pence and the COVID task force team, and I'm doing this at FEMA, with and through a lot of functions at FEMA, DoD, and other agencies. Which I have to remind you that in the federal management response, it's really about local execution, state managed, and federally supported, right? So not normally feds in charge. The national stockpile had been sized for like a regional biological event, and it had been given out already. So I was the federal supply chain guy without any federal supplies. And oh, by the way, infectious disease control, and everybody was complaining about not having PPE, was a disposable product. The majority, like 80–90% of it, manufactured overseas. No real manufacturing of it in the United States. And the supply chain was really cost driven and just in time. And you had demand of 300 to 400%. You can go next slide. And so I'm very familiar with a DoD landscape. And so then I get dropped into an operational landscape that you had another alphabet soup of agencies and people involved in here. So on the right-hand side, you have a lot of the civilian secretaries, civilian agencies, the assistant secretary for preparedness and response at Health and Human Services that should have had this response wired, centers for disease control, public health officers, right? Like the guys that were wearing Navy uniforms, FEMA, FDA, Food and Drug Administration, NIH, Centers for Medicare Services, CMS, I'm not even sure I could spell CMS prior to this. And then you had the FEMA whole aspect of 50 states, 6 territories, 10 FEMA regions. All the FEMA region people think they're in charge of a bunch of states, right? Everybody thinks they're own something. And on the left-hand side, you had all of the commercial stakeholders and all of the medical stakeholders from hospital association, nursing association, medical association, association of manufacturers. There was an association for non-woven fabric. Non-woven fabrics are the things that are essentially N95 masks, surgical masks, and other things. And they were a part of the problem and the solution, right? And so not only did I have all of these other folks, I had Treasury, I had Commerce, I had DOD. You can see that it was to keep everybody on the same page and make progress, because they were all had a point of view. Like the American Nurses Association didn't want to play at first, and they didn't like some of the things that I was doing. And it took me a very long time to win over the Nurses Association, who I needed to ensure that the nurses were on board, right? And they have their own constituents, right? So you think about, not only, I haven't even mentioned Congress, I haven't even mentioned all the 50 governors, I haven't even mentioned all the politics, right? So you can see this incredible landscape of, oh my God, I got to keep all of these constituents in line to go make progress. So go next slide. I want to jump back again to the swirl of, we can't go visit grandma in the nursing home because the nursing homes are all under attack from COVID. Our healthcare workers are burnt out and don't have the supplies they need. Everybody's going to need a ventilator. And then we had like governors like Governor Cuomo pounding his fist on the table at press conferences and yelling at Trump about, hey, I need, New York City alone needs 30,000 ventilators, right? So here I get dropped into this political and firestorm of news media. Go make progress. And the president gave me one task: get our healthcare workers what they needed when they needed it. So what did I do? Next slide, Dan. So I came up with 4 lines of effort. The first line of effort was preservation. That line of effort is just what it sounds like. I was the guy that got the Centers for Disease Control to break the gold standard of infectious disease control and reuse supplies. You were going to reuse an N95 mask. You were going to create COVID-only wards where you don PPE and you spent all day in the same PPE treating COVID patients, right? So this was me in a global pandemic managing scarcity. And I might as well cover it now. It was a global pandemic. China had shut down manufacturing. Places where we got nitrile gloves like Malaysia had shut down manufacturing. So anybody thinks that there was plentiful things to go buy and there were all of these brand new sources of supply, you're kidding yourself. There was nothing to go buy. And there was a huge black market. And I wasn't going to spend taxpayer dollars on black market and playing in that environment. So we used a preservation line of effort to make what we had go farther. Having said all that, we did try to go buy things around the globe and get them to the United States as fast as we can. This line of effort, acceleration, became Airbridge, where I worked with 9 or 10 commercial medical distributors, the Cardinals, the McKessons, the AmerisourceBergens, all of the large medical distributors that had 90 to 95% of the hospital beds covered, about that same percentage for nursing homes, first responders, right? They had certifiable sources of supply. So we worked with them to reorientate the network from a maritime mode of transportation and we paid for flights to fly it and bring it to the highest priority regions of the nations. The third line of effort, which I'll talk more about later, I'm gonna make mention of it now, but talk more about it fuller. And it's the line of effort that Jim Liberco worked really hard for me, which was this distribution, or really it was a data line of effort where we fused together 9 or 10 different commercial ERPs. So all of the big medical distributors, I got their ERP data, so to speak, daily transactional information, and we created a supply chain control tower, which I'm going to hold on that because I have a slide on that to talk about how we manage the priorities. The final line of effort was this expansion where we used the Defense Production Act to scale U.S. production of N95 masks, nitrile gloves, surgical masks, face shields, including nasal pharyngeal swabs, test kit items, right? Ventilators, right? Everything that we use the DPA on was in this expansion line of effort. The distribution line of effort, or the supply chain control tower, fed the expansion line of effort, whereas the control tower told me what the demand was from every hospital, nursing home in the United States, and what the supply was, what was coming in from sources of supply. And then we used the Defense Production Act to scale U.S. manufacturing to close any gaps. So Dan, go to the next slide, because really the heart of the task force, absent using the DPA, was this creation of a supply chain control tower where we use the DPA and an antitrust authority to allow FEMA to ingest daily transactional ERP information, consolidate it to one view, and every one of the distributors was okay with it being consolidated at FEMA, but certainly they didn't want anybody to see who their sources were and what market share they had. They were okay with me doing this at FEMA and consolidating it, and really the antitrust authority allowed us to provide the right protections over the top of this. And what Jim Liberco was able to go do, and we started very small, 5 line items, 6 line items, the things that you saw in the news where our healthcare workers didn't have: isolation gowns, face shields, masks, N95 masks, right? All of the PPE, we started with those and got their ERP data, what they had in the warehouse, what was coming from their sources of supply, what their orders were from every one of their customers, and what they were filling to every nursing home, hospital in the United States. And by the second week of April, I handed Vice President Pence a heat map and a printout, and every other member of the COVID task force, a printout of what got delivered to every county in America, in every state, in every county, and what was being delivered by commercial and federal sources to those locations. And it was an absolute game changer, because we had visibility on what was coming and what was being ordered, and we understood how we were able to feed priorities. And we developed a 96-hour battle rhythm where Dr. Birx and her epidemiological information pinpointed, hotspots of where COVID was most prevalent. And so we were able to prioritize the commercial distribution network. Again, there was only certain amount of variable sources of supply. And so we were able to prioritize what we had and what was coming to us to those hotspots in a 96-hour battle rhythm. And the control tower would allow us to see the heat map change. So it went from, New York, New Jersey, Chicago, New Orleans, right? And as we moved PPE around the United States, we could see the distribution of it shift to our priorities. So we knew where material was going. By late spring, we added data feeds from nursing homes and hospitals, and really that's the bottom half of this slide, where instead of trying to understand who's hungry, we added data feeds from nursing homes and hospitals on how many days of supply they had, and so to speak. And I ended up managing 5 to 8% of nursing homes that didn't have several weeks of supply, and maybe about 4% of hospitals didn't have 30 days of supply. And so then we started essentially a push response to those that didn't have material by the time we got into, May timeframe into June. I can't stress this enough. We as a nation walked into the pandemic, no medical industrial base. We didn't make any of the products that I talked about. We barely made anything for test kits. We didn't make anything really for nasal swabs for the test kits. We had one source of supply, Puritan swab in Puritan, Maine, which we used the DPA on that guy about 7 times. And CDC and public health, who runs this data network, had no material requirements coming from hospitals and nursing homes. So if you were a hospital and needed something, you had no way to tell the bigger public health upwards that you needed anything. Essentially, you went into as that New York Times headline, you went into combat with no op rep 5 feeder to draw a parallel. What cash reps I have, what fuel I have, what ammo needs I have, right? Just think about that. I had to go create the data structure to allow me to go manage this. And I have to tell you, Admiral Brett Joie, in his book, if you haven't read it, he was the gray-haired public health admiral that took over testing. He and I worked very closely together. In his book, he talked extensively about the supply chain control tower, and to the point where it should have been built decades ago. And I have to tell you that Jim Liberco, I think he's online tonight. I hope he is. I think I saw his name on a registration list. I don't think people understand the magic that he and the small band of team did to put that together, right? Dan, go next slide. I'm going to wrap up here in a second. So we started the pandemic on the left-hand side with what you see is like 18 million N95 masks. And so as we used the DPA and we ramped production, we had a target of feeding both commercial distribution and feeding the national stockpile, rebuilding the stockpile. And so we think we had a target of about 300 million N95 masks by December. We exceeded that, and were able to feed masks into the commercial sector so our healthcare workers could have that. And really, by midsummer, almost 90% of almost 90% of states had at least a 30-day supply. 50% had a 60-day supply of stuff, right? And so we were pushing them to have a 60-day recommended supply, and that the national stockpile was going to have about a 90-day supply. And we were working programs to have U.S. suppliers that could back up any kind of surge, because we realized that the COVID was going to go up, down, probably spike again, right? And so we had to set ourselves up for a future. I'm going to talk bad about Health and Human Services for a second, and just because they didn't really have any supply chain or logistics professionals supporting them. The folks that manage the national stockpile were given authorities to put stuff on the shelf. And so you could think of the national stockpile folks as warehousing. They did not have surge contracts. They weren't given the authority to spend money on those types of things. So that stockpile that we went into the pandemic with, and I think still the stockpile we have today, is not backed up by surge contracts, U.S. manufacturing, etc. So the things that we worked on and trying to produce a 90-day supply, surge contracts, U.S. manufacturers, still not really in place. Go to the next slide, Dan. And it's just some final thoughts before I ask Richie and Colin to give some personal perspectives. You can't surge what you don't have, right? And so for the Navy today, DoD, and we're seeing it in munitions productions, like all of a sudden, holy smokes, we need to produce 155 rounds. You can't surge what you don't have. And so if you don't have a supplier base that can surge to wartime demand, you're not going to create it overnight. You're just not going to create it overnight. The DPA is a wonderful tool. It's not a magic wand. It's a rheostat. It takes time. It took us almost 6 months, 5 months, to scale N95 mass production with nobody shooting at us, nobody blockading anything, pouring concrete, building facilities, getting tooling, training workers to get to the 360 million masks a month, from 30 million a month to 360, 400 million a month production that we needed. It took us 5 months to go get there. Preparedness. Time is your enemy. Preparedness, right? Detailed planning, and the DoD is all about that. Health and Human Services didn't really have a great handle on the pandemic plan. Nor did Health and Human Services think of themselves as having to manage the medical industrial base. And so you can't pick up a newspaper these days without an article about the industrial base, bringing manufacturing back to the U.S. Nobody liked what happened during the supply chains during the pandemic. Those are all great. Takes time to go build back a supply chain. I already covered the national stockpile. Got to have an agile manufacturing base. Covered the DPA. I used every ounce of every skill set that I had as a supply corps officer. I'm a financial manager, a supply chain guy, acquisition and contracting, joint logistics, transportation. But the most important thing was about managing all of those relationships. And I think Richie and Colin are going to talk about that. And so, Richie, I'm going to stop talking about the task force and the work we did, and turn it over to you to give some of your own personal perspectives.
All right, sir. Real quick sound check.
Good.
You hear me? Okay. Okay. Good. Good. So, hey, good evening, everyone. It's great to see some familiar names on the list, and certainly appreciate you taking time to listen to our experience. As the Admiral mentioned, the Friday before we went over to HHS and then ultimately down to FEMA was Admiral Trainer, Captain Trainer at the time. We had an all hands call for the Joint Staff J4, if you will. So I'm taking you back to my personal experience a little bit. We had a guest speaker that day. We were building our plan to telework, do social distancing, and all the things that they were directing us to do. The guest speaker was an Air Force Reserve physician, infectious disease expert, and in no uncertain terms, he basically said this is a serious disease, right? And he kind of walked us through a little bit of that, and then of course, into Sunday evening, I got the email that HHS was needing some support. So as we go into HHS, it was literally the calm before the storm. You go into that headquarters and it was quiet. as the Admiral mentioned, the staff there just seemed to be vapor locked a little bit. They really didn't know the next steps. By that evening, Monday evening, we were down the street at FEMA, and it was quite the opposite. It was floors full of people that had been pulled in from the White House and other agencies to help source personal protective equipment across the globe. And think of large rooms with just tons of people. Many of these were young professionals. Some of them were private equity people. Just a range of people in the room. Huge effort going on, but what we learned in the first half of that week was it wasn't yielding a whole lot for the nation. There was very little organization. There was almost zero awareness of how government acquisition worked. There was no unity of effort. And I think that was a huge piece of what we brought, even as a small team of military, and it was a joint team. We had Army and Air Force on our team as well. We brought stability to a staff, right? We couldn't really start to deliver any product until we, organized ourselves in a manner that could allow information to flow in a way. So we, Admiral mentioned battle rhythm. We established a battle rhythm. We had a chief of staff that drove discipline and performance. We added definition to the 4 lines of effort that Admiral P just mentioned, which needed a lot of definition. Lines of effort in and of themselves aren't going to get you anything, but you need to really have the finer points built into those lines of effort. So, all of you, we would have much rather gone into battle with almost everyone that's on this line, but we had to go into war with who we had. And that was a lot of civilians that needed a lot of direction and discipline. So I think that was one of the biggest values that our task force brought to this effort. FEMA, a little bit about FEMA, right? They were built for floods and tornadoes and hurricane response. They were not built for pandemics, and probably, are still struggling to get lessons learned into that organization to deal with something in the size and scale that we encountered. So they were learning on the job just like we were, and trying to figure out, how they respond to such a large national event, really a global event. Can't speak enough about Jim Laberco and that data tower. That was a huge effort to help us see the battle space, if you will, right? We were essentially riding blind. That was a lot of manual effort, a lot of lawyers involved, a lot of data people involved, and for those that are in industry, right? I mean, they're just not, the medical surgical distributors just weren't going to hand that information over. That was intellectual to them. It was their property, right? So we had to enter into a lot of agreements. We had to make sure that the details of those information sharing agreements were in place before they would turn that over. And that became a big lift before we could even start to build that picture. So that was huge. Building partnerships in that complex, rapidly changing environment was absolutely huge alongside our medical surgical, the big 6, as I call it in the article. And hopefully you'll get a chance to read the article in the newsletter that we wrote right after this. Industry groups played an outsized role, right? When you think about the American Hospital Association, the American Medical Association, National Association of Manufacturers, the layers of this operating environment were immense. And we had to learn very quickly how to navigate through that in sort of a non-emotional way. This was a very emotional, traumatic experience going on, but we had to be data-driven. We had to be disciplined in a way that was able to bring clarity and stabilization up to the White House, right? So that's what was needed to reassure the nation from the podium, so to speak, when the information demands were building and the pressure was building. I'd like to encourage you, when you get a chance, Google Prestige Ameritech, and I'm talking about a small firm in Texas. 3M, Honeywell, there was a lot of the big manufacturers, but it's interesting to go back and look at some of the articles that were being published. Whatever your news source you prefer, you can probably find this guy. He was sounding alarm bells in January of 2020, and he was calling the White House, and no one was really listening to him. He got into Miss Wolf at HHS, and she didn't have much for him at the time, but he was telling the executive branch that they needed to start to get his product because he was getting orders, a lot of orders, a serious spike in demand from across the globe, including China in January. So he was, pretty effective in previous pandemics when we were trying to buy product as a nation. But you'll see just kind of how we were slow out of the blocks and slow out of the gate. And Prestige America Tech is just one of those companies that's a little bit smaller, but they're one of the few domestic suppliers that we had. And of course, just based on the bulkiness of how we acted as a federal government, he was concerned that he was going to create a bunch of product that he couldn't move. But he ended up coming through in the end. But it was a lot of getting serious commitments from HHS to really bring him in line. In addition to that, and I'm calling in from Singapore. I'm stationed over here now at CTF 73. One of the things I've been able to do since I've been over here was touch in with 3M locally here, and we were pulling a significant amount of product from Asia during this time, sourcing it, flying it over via air bridge, and of course using the Big Six and other distributors to move it to the point of need that was ever changing within the U.S. And it was interesting to revisit some of the perspective of 3M locally here in Singapore. With they were going through a hard time because they were fighting off their clients in this part of the world based on actions we were taking. It was an American company, so we were prioritizing pulling the product over from them. So interesting to revisit many of the stakeholders and partners we had throughout this event. The article that we wrote, Colin and I wrote with Jim and some others, really only captures about 120 days of the effort. I know Admiral P stayed longer. We brought in General Sanford from DLA Richmond to be sort of the deputy commander, if you will. That really helped. But as I reflect on it, I think one of the key benefits we had from our position was just bringing stability and organization and clarity to the fight. And lots of great questions, lots of as I was reviewing those, lots of very relevant questions. But as Admiral P mentioned, what does it mean for us today? Well, many lessons learned, but that domestic production, manufacturing of ordnance, spare parts, any class of supply, if you will, has got to happen well in advance. We've got to figure out the will and the funding and the policies to get that in place before a larger event like this, and conflict perhaps with a near peer adversary. So learning that in spades from this part of the world, as I've had 3 good years of experience watching the PRC Navy up front, distribution in this part of the world with challenges just like distribution challenges back then, and getting those systems and people and organizations in place now is absolutely critical. So I'll pause right there, let Colin give his perspective, and then we'll be happy to answer any questions.
Sure thing. I'll do the same. Quick mic check. Good to go. Good evening, everybody. I'm Colin Amaro. So I'm a former lieutenant in Supply Corps and Admiral P's exec on the Joint Staff. So while they focused a lot on the nitty-gritty supply chain, what we actually did, I'm going to focus more on the dynamic of what we walked into from the Pentagon. So a little bit of background on me. I spent 3 years on the Abraham Lincoln. From there, I was selected to do a joint operational logistics internship on the Joint Staff. I initially spent time in Deployment Distribution Division, and then I fleeted up to be Admiral P's exec. At the time the pandemic hit, I had been Admiral P's exec for about 9 months. So I had been well-versed in kind of the organization of OSD, Joint Staff, operating at a high level within those staffs. The funny thing is Admiral P was adamant about having a Supply Corps lieutenant be his exec during his time. And that is not standard on the Joint Staff. The average exec on the Joint Staff, as many people on this call probably know, is a senior 05 and maybe even an 06. So if you can imagine all the execs getting together and they're all senior 05s and 06s, and then you have a dinky little brand new lieutenant, having conversations at a level, you learn to sink or swim very, very quickly. And that's not a very forgiving environment. So that's kind of a skill that I took into what we're about to talk about next. So I think from my perspective, one of the biggest changes when we got pulled over to HHS was not having the top cover of DoD from a political aspect. So we're all trained as uniform wearing service members to be apolitical. And we got forced into a situation that was inherently political, and we were not necessarily trained how to operate in that situation. So from day one, we stepped into FEMA, as Captain Jenkins said, and we had very senior level White House officials screaming at us to activate Transcom, not really knowing what they were asking for, and all sorts of crazy things. And the senior team there at FEMA was able to kind of bring organization to chaos and kind of calm folks down. I very quickly realized that from the perspective of the Executive Office of the Vice President and the Executive Office of the President, the Supply Chain Task Force, at the staff level, what the Supply Chain Task Force was largely an unknown entity. And I could tell just based on the way information was asked, the way people kind of approached us, that they didn't really know what we were there to do. And that's really a factor of, unsurprisingly, the lion's share of the work in the Executive Office of the Vice President and the Executive Office of the President is done by 25 and 30-year-olds. So you see all of the senior people, but the day-to-day is run by, as Admiral P would call them, children. But I say that laughingly because they were about the same age as me, so I guess I was a child in that situation too. So what I kind of focused on was, one, being a filter for Admiral P to make sure that nobody except for the senior people were reaching out directly to him, but also to establish kind of good comms with every single entity within those offices. And so what I would do, and just kind of using my social aid background and general knowledge of the West Wing, is when Admiral P was in the daily briefings with the Vice President and sometimes the President, I would walk around the West Wing and I would pop into offices and I would introduce myself, which was probably frowned upon. I probably shouldn't have been in those places. And, I was just able to, about a month or two in, there wasn't really an entity within the Vice President's office or the President's office where I could reach out at the staff level via text message or via phone call and get information. And I think that proved to be pretty valuable, especially as things heated up and things got extremely political. My phone number was very, very, very regularly passed around to very senior people. To give you a feel for that, I had Secretary Mattis call my cell phone asking for Admiral P. I had Jeff Bezos call my cell phone asking for Admiral P. I had, an unbelievable amount of senators and congressmen call my phone asking for Admiral P. And I think that, if it had been those entities reaching out directly to him, he was extremely busy. It would have been a lot of chaos. But I positioned myself, I was not qualified to do the supply chain work, or at least I didn't think I was qualified to do the supply chain work that Captain Jenkins and Admiral P and the team did. But what I was qualified to do was kind of feel out the West Wing, get a vibe for what they were trying to do on a day-to-day basis, and be the touch point for them in information collecting, or in their efforts to collect information. And, I can't tell you how many times, and Admiral P knows this, they would ask me for a couple bullets on what we were doing. And a day or two later, we would see those exact bullets on the news, or those exact bullets at a press conference that President Trump was up there doing. So, it didn't come without lessons learned. Like having been 4 years in the review, there are definitely things I wish I had done differently that I think could have made us even more effective. I'm very proud of the work we did, but there was really two aspects to being successful in this situation. It was getting the frontline healthcare workers what they needed, but then it was also telling the story. And I don't think what I realized at the time that I do realize now is that we were fighting an information war. So not only did we have to do the thing, but we also had to tell the story in the right way, because from the public's perspective, if the media didn't report on it, or if the public didn't see it on Twitter or something like that, then it didn't happen. And the general public doesn't understand supply chain, and so I think that one of the biggest lessons learned, I know that folks probably have a lot of questions on lessons learned later in the program, would have been just something simple as understanding that none of us were public affairs officers, and I would have brought in a PAO or somebody from Joint Staff at the very, very beginning. I would have made Admiral P a Twitter handle as the director of the supply chain task force, I would not have given him access. And then I would let I would aggregate all the pictures from the globally, and kind of make sure that those were shot out on a daily basis. I think that if that's one thing I could take back, I would have done that differently. But I think that the most important thing there is that Admiral P was the face of the operation. He was the idea man. But we went over there with such a skeleton crew and a not a great understanding of what we were being asked to do, that the finer details of things like just getting information out there were things that we didn't have the luxury of of taking into account. And so I think that from a supply core standpoint, supply core, especially when you're on a ship at sea, like you're doing many things outside your actual job, right? And being able to juggle all those things, being able to oversee different lines of effort, which is something I think I learned to do pretty well at sea, was definitely beneficial to me in this scenario. And I think they preach from the very beginning at BQC that relationships are extremely important and networking is extremely important. And I couldn't agree more. And I think that this, what we experienced in the White House and in FEMA and HHS kind of solidified that. And just kind of a fun fact, in those days where I walked around the White House and FEMA and HHS just meeting different people, I actually did also meet my future wife, who I'll marry in September. So COVID wasn't all bad. But no, the team was great to work with. I do truly look back on the dark days of COVID as some of the most professionally rewarding of my short Navy career. So I'll stop there.
Hey, Colin, Richie, thank you. First, I think you can tell that Colin undertook an incredible lift, and the things that he did. I mean, he left out on like a first name basis with Secretary Mnuchin, who was negotiating all of the funding packages, and Colin would hand me the phone, hey, sir, it's Secretary Mnuchin, right? And so I think you can't understate this relationship thing and how well Colin enabled us by working through that. Richie was essentially the point person working with industry. Richie won't tell you, but he got Hanes to go make gowns. They weren't making T-shirts because nobody was buying T-shirts. You turn Hanes on its head, and they were making cloth isolation gowns for the nation, right? And so Richie was my industry point here, and I two very humble Americans that got thrown in here, and I can't say enough about them. And you heard me talk about Jim Liberco. I can certifiably tell you, when I handed the Vice President, Secretary Azar, Dr. Redfield, CDC, et cetera, right, those reports, and then we gave every governor reports out of the control tower, that temperature on supplies went completely down. We had it, right? And so I just think that Jim, Richie, and Colin, people ask me if I'm going to write a book. I need to write a book because I need to get these names out. I need to get guys like Pat Work, General Work. Now he's the 82nd and 101st. I forget. Colin, you can chime in if you want, but he's now a senior
82nd Airborne Commander.
Yeah, 82nd Airborne Commander. Pat managed the procurement of all the ventilators for me, and then the distribution of all the ventilators across not only in the U.S. We were given ventilators to other nations, and managing a process with the White House and Department of State. I can't tell you the amount of work that guys like Pat Work did. So there's just, if I write a book, it'll be about their names, not mine, and getting the American people to understand what had to happen to get our healthcare workers what they needed, when they needed it, and the people behind it. I think I'll end on that. I don't know if Fast Eddie, if I'm handing it back to you or Ted, or question.
No, I'll take it, John.
Yeah.
And so no, thank you. Thank all of you. I mean, it is an amazing story. And the really super interesting insight from Richie and Colin. And I love the fact that John, you insisted on your aide being a supply co-op. I mean, I didn't know that. That's really, really interesting. We do have a couple questions that have been submitted. A lot of questions that have been submitted. We don't have a lot of time left, so I'm just going to hit a couple. So there was a lot of questions on lessons learned. You had the slide that said final thoughts, and but beyond that, was there any kind of hot wash after action report critique where you got together and kind of codified something, and that can be worked into the various establishments?
Yeah,
to talk to that a little bit.
Yeah, short answer. I gave Secretary Azar a multi-page letter when I retired, and in that recommendation, in that paper, we captured what the task force did, what work was in motion when I retired, and recommendations for him. And I'll give you the primary recommendation was Health and Human Services needed to stand up an office to manage a medical industrial base. They had an office called BARDA, a Basic Research and Development Agency or something like that, that cared about the next shiny medical object, not managing a medical industrial base. And so they did. They stood up an industrial base office to try to understand the things that are needed to make viable a medical industrial base. That office has not really matured, but at least there's something there. That was one of the recommendations. Now, I've spoken to the Senate, I've spoken to the House, right? I've spoken to a lot of people. There's been IG reports, there's been other reports, right? I wish I had a better answer, but I don't think much of what we learned during the pandemic has been in place to make us more resilient.
And unfortunately, I think that's not uncommon. After I remember reading lessons learned after the fact and things that could have helped. But so, anyways, no, interesting. We also had a lot of questions on DLA. So we've got this huge organization. How were they tapped, and could they just have been used instead of standing up this task force?
I got this. So great question. Now, 2020 hindsight, right? So if I was if I knew in like October of 19 that there was going to be this pandemic and that somebody was going to need to be in charge of supply chains, right? Imagine middle of March, late March 2020, I come in the door and say, nobody buy anything. I'm going to be the central buyer. With what business system, with what funding authority, with what distribution network, right? It just wasn't going to happen. People were off and running, and there was nothing to buy. Now, I did use the commercial distributors because they had the route, they knew the address of every hospital in America, every nursing home in America, etc. We used DLA to put things on contract, and that we either ship directly to states, put into the commercial distributor to get right to nursing homes. Like we bought supplies, boxed them up, and gave a month's worth of supplies to every nursing home in America. We did that a couple of times, right? So DLA was used as a buyer for things that we didn't compete with, we wouldn't want to compete with commercial. But there was no good way at the outset of the task force to allow a central buyer to go do this. One, there wasn't anything to go buy. Two, we were, could you imagine like the slowdown, and how you were going to go manage that? No, we just it wasn't viable. But we used DLA to go create demand signal for the organizations that we use the DPA on. DLA was giving them contracts.
Okay, no, thanks. And last question, I'm going to respect people's time. We're going a little bit over, but we did have some questions on on the contributions of the reservists. And Richie, I know in the article you wrote for the Supply Corps newsletter, like in the fall of 2020, you gave a shout out to them. And so just in this format, John, can you just give a kind of a quick summary of the impact they had?
So I think Kurt Wendelken and a few others were in on this, but we brought in Navy Supply Corps reservists who had an IT background. There was folks that worked at Amazon. I think there was folks that worked at Microsoft. There were folks that worked at, right? And they came in and they helped Jim Laberco go create this supply chain control tower. And it was a handful of people. It wasn't legions. And so they helped me eat the elephant in small bites. Just start somewhere. And that's what they did. And like, it was miraculous. I can't tell you about how the president, the vice president, other senior leaders, the governor of Maryland who ran the governor council, I just lost his name, Governor Hogan. He was astounded at what information we were giving to the governors out of the control tower and the visibility we have. He just couldn't believe it in a short amount of time. And so those reservists, and I think Richie caught most of their names in the article, were key. The reservists were absolutely key to get this done.
That's terrific to hear. And I'll just say, yeah, you definitely have to write this book. You need to get that out here. So again, thank you to everyone. And Eddie, I'm going to turn it over to you.
Well, thank you. Thanks, Ted. Thanks, John, Colin, Richie. Hey, I just want to say, you know, what you and your team did for the country and I mean, humanity is incredible. And I want to thank you for that. And it just brings back so many memories of that timeline. John, I remember you getting ready to retire. You came down and we met at Home Depot. And that all this happened after that. And it's unbelievable. And for everybody on here, John and I go way back. He served with me at Surfland on my final tour of active duty. So it was great. It's great seeing everybody. I want to thank you all for what you did. I want to thank you for for this presentation tonight. Very, very meaningful, very beneficial. And it really gives me renewed faith. And it's something I always tell people when they ask me, what is it that naval officers do or supply corps officers do? And I always kind of distill it down to, I said, you know what we really do? We solve problems. And man, that's what you guys did. So I think it's absolutely great. And I want to thank you. Thanks for staying connected to the Navy Supply Corps as well. And Dan, with that said, I'm going to turn it back over to you to close it out. Thank you, everybody.
Thanks, Eddie. Thanks, Admiral Polacek, Richie, Colin. This has been an awesome webinar. Thanks for staying with us. Again, thank you to our webinar sponsor, CTG, Division Blue Raven Solutions. Thank you for attending this webinar. Please register if you haven't already registered. Use the QR code on the screen there. And please support us. We do need your donations. We're a small nonprofit. This will help us provide more programs and services to also the whole Supply Corps community. But again, thank you for attending. Check us out on social media and enjoy the rest of your evening. Have a good evening.